Hi, welcome to Pathology Riddles. Today we will be discussing about differences between benign and malignant tumors. Benign tumors often resemble the tissue of origin, while malignant tumors show usually poor resemblance to the tissue of origin. Benign tumors are well circumscribed, while malignant tumors are poorly circumscribed, which means they are invading into the surrounding tissue. Benign tumors, the surrounding tissue is compressed, while in malignant tumors, as discussed earlier, the surrounding tissue is invaded. In benign tumors, the rate of growth is usually slow, while in malignant tumors, the rate of growth is usually fast. In benign tumors, the basal polarity is maintained, while in malignant tumors, the basal polarity is usually lost. In benign tumors, there is no nuclear pleomorphism, while in malignant tumors, nuclear pleomorphism is seen, that is, different shapes and sizes of nucleus are present. In benign tumors, the nucleus to cytoplasmic ratio, also called NC ratio, is maintained, while in malignant tumors, the nucleus to cytoplasmic ratio is increased, which means that the nucleus becomes larger in comparison to the cytoplasm. In benign tumors, the mitosis is typical, which means the mitosis is bipolar, while in malignant tumors, the mitosis is increased as well as atypical. So the mitosis can be multipolar, it can be tripolar, tetrapolar, etc. Benign tumors do not metastasize, while malignant tumors, the metastasis is present. In benign tumors, the prognosis is usually good, so once it is removed, the chances of recurrence are less. While in malignant tumors, the chances of recurrence are high even after treatment. That is all for today. This is Dr. Bismay signing out. Please do like, share and subscribe the channel.